As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, US versus China, where I'll take you behind the scenes in the tumultuous US-China relationship. Find Face Off wherever you get your podcasts.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked question that pediatricians regularly receive in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by no one. That's right. I'm going to be solo and share my expertise with you as a public health scientist. All right, so today we're going to talk about measles vaccines and whether your child can receive their MMR vaccine early. The clock is ticking, so let's get to it. All right, so with news of measles cropping up around the country and around the world, some folks have asked whether their child can receive one or both doses of the MMR vaccine early. So let's discuss. Now, the CDC recommends the following MMR vaccine schedule. Dose 1 is typically given between 12 and 15 months of age, and dose 2 is typically given between 4 to 6 years of age. Now, the second dose can be given as early as 28 days after the first dose if needed. And if your child falls behind, you can consult their pediatrician about getting them on a catch-up vaccination schedule. Now, adults, I'm talking to you. So adults born after 1957 who don't have evidence of immunity, such as vaccination records or lab tests, should get at least one dose of the MMR vaccine. Now, specific groups, including healthcare workers, international travelers, and college students, may need additional doses or earlier vaccination. Now, with these circumstances and cases of measles cropping up, like I said, people are asking the question, can my child get the vaccine early? And the answer is yes. The MMR vaccine doses can be offered early depending on certain circumstances. So dose 1 may be given between 6 to 11 months of age, and dose 2 can be given as early as 28 days or 4 weeks after the first dose. This is a conversation you really have to have with your child's pediatrician. Some reasons for early vaccine doses include local outbreaks, travel to an area with measles risk, or to catch up on a delayed schedule. Some parents are asking whether adjusting the MMR vaccine dosages would mean that their child received an early dose or an extra dose. And the answer is, it depends. If an infant receives a first dose of MMR vaccine at 11 months or younger, they should then follow the recommended schedule and get another dose at 12 to 15 months and then a final dose at 4 through 6 years. However, if a child receives only the second dose early, that will likely be considered an early dose and not an extra dose. But this is something of a gray area. Certain schools may have specific vaccine requirements, so it's kind of situation specific. You might also want to check with your insurance provider to make sure that the extra or early dose will be covered so you don't get any surprises. Well, we hope you learned something today, and we have lots more to share. Remember, you can get your bite of health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you like this podcast, can we recommend another one? It's called Big Picture Science. You can hear it wherever you get your podcasts, and its name tells part of the story. the big picture questions and the most interesting research in science.
Seth and I are the hosts. Seth is a scientist. I am Molly, and I'm a science journalist. And we talk to people smarter than us, and we have fun along the way. The show is called Big Picture Science, and as Seth said, you can hear it wherever you get your podcasts.